Of all the technologies and all the tools in the toolbox, the most important one is the last 25 years of education, is knowing pattern recognition and recognizing the different injuries. Knowing that this mechanism can lead to this injury, that these are the things that were associated with this pattern, is getting a good history, doing a careful examination, and just having seen enough of these. That's why specialty care is important. If you see someone who has a shoulder injury and then 20 minutes later someone who hurt their wrist and maybe someone who sprained their ankle or has a fracture, it's not the same as seeing 30 people a day who just have foot and ankle injuries. At some point, you're going to get it, even if you weren't even trained in it. You do that every day for years. You have to have your eyes closed to not start recognizing patterns. Now, clearly that's not the education of a surgeon. We do it in a different way. You go through medical school, you go through orthopedic residency, and then you have generally a fellowship where you have an intensive training with surgeons who specifically do that type of work. And it's an intensive time period where you get flooded with every possibility you can possibly see. And generally for most of us, it's with multiple professors who have different areas of interest. But that's the most important tool, is injury recognition and management by a really thoughtful and well-trained surgeon, more so than any imaging. In fact, it's a fool's errand and trap to rely on that imaging more so than your experience. There's this concept in medicine which is something that there's a big backlash for. We have this concept of levels of evidence, that the only real level of evidence is with a large double-blinded study. Interestingly enough, in what we do, that's just not true. The best level of evidence is by a well-trained surgeon who's spent 40 years doing it and who has this wealth of experience. That level of evidence of a very thoughtful personal experience means more than trying to amalgamate a bunch of different studies together. The vast majority of things that happen commonly happen commonly. However, you're not in a position to invent a diagnosis if you've never heard of it before or you don't know what to examine for. The thing that is important is when you see something that you recognize, you confirm it. And part of that confirmation is doing serial examinations. You have an assumption of a certain pattern of injury. You treat it appropriately, but you also see somebody back and reevaluate. And that reevaluation is on the assumption, I think I was wrong last time, let me rethink this. And that's the presenting assumption every time I walk into a room, and for generally most surgeons. You never get caught in the same trap of that groupthink, self-groupthink, where you have this assumption and then you just keep playing on that. Frequently, we'll send folks for other opinions. In my office in particular, I have a partner who does the exact same field of medicine. It makes it a lot easier if I'm even questioning in a bit. Tomorrow, go across the hall, get a fresh look. Don't tell me anything, I won't tell you anything. Get a fresh look. It's easy, it's in a grand scheme of medical care cheap, and so that's a very important thing. But the other component is you have to recognize when it's different. If you don't know what the common things are, you're never going to be in a position to recognize that one thing that just doesn't seem to fit. And so if everything is different to you, because most of your work is in shoulders and knees, because that's the most common field of orthopedics, and you see something in the ankle, well, it's always different. You're not really in a position to really know that it's unusual or different. You should be doing a different pathway. But if you see a lot of it every day, and most of it falls into this category, most inversion injuries are going to injure the ATFL ligament. Well, what if they don't? What if they injure the anterior syndesmotic ligament? It's going to look a little bit different than the other 25 that you saw in the last 2 days.